Good morning, I am Dr. Snehal Reddy, consultant, gynecologist and fertility expert from ARC Fertility Center, Gachibowli, Hyderabad. So what is the procedure for egg freezing? Yes, you have to undergo a procedure called oocyte pickup. So where does it start? You go meet your gynecologist whenever you think of going for an egg freezing. If you're married, go along with your partner, or you can take a consent from your partner, or you can just meet her. You will have to undergo a blood test, which is AMH. Your overall fertility checkup will be done. Your scan will be done to check your AFC and just the outcome to predict. Next, what do we do is on the day 2 of your cycle, we run a few blood tests which are hormones which should be down regulated, and we'll start for injections. So your hormonal injections start on day 2 or day 3 of your cycle, which will continue daily. You'll have to take daily injections for 10 to 12 days depending upon how the growth is. Then you will be triggered on the 12th day, and your oocyte pickup, which is the OCR we say, the procedure will be done under anesthesia on day 14. That day when you will get to know how many eggs you have got, how many we have picked up, and how is the quality of the egg. So that day you'll be under NBM, which is nil by mouth, and around whatever time we have triggered, will after 36 hours will be your pickup. That day you'll be anesthetized, and there will be a needle, OCR needle, which is a very small procedure. We will do the egg pickup. We will hand over the oocytes to the embryologist for denudation, and they will give us how many mature eggs you have got, how many mature eggs, and how many can be used and frozen. Okay, so that is about the procedure. So the age, so if you are less than 35, or if you are like around 28 to 30, 32, you will need around 12 to 15 eggs, so that the live birth rate is 80 to 85%. If you're crossing 35 years, so you will need around 20 mature eggs, so that the live birth rate will be 80 to 85%. Next, if your age is around 38 to 40, you will need 40 mature eggs, so that your live birth rate will be 40 to 50%. So this is how the age. So now what I have said is the number of eggs we need to get a live birth rate, like you will continue, you'll get pregnant and you'll have a living child. Okay, this is not about the genetics. Now if I talk about the genetics, it's the same again. So if you're crossing 35, if you're around 28 to 30, the chance of your embryo or the baby being genetically defected, or the aneuploid rate is less. Once you cross 35, it increases. Once you cross 40, it is the most chances, like most of the embryos will be aneuploid embryos. So live birth rate is different, and being genetically abnormal or the aneuploid embryo rate is different. So this is about how many do we need and how many do we have. So how many do we need depends upon your age, because the quality, as I said before, will start dropping after 35. So if you like around 32 or 33, you'll need around 10 to 12 eggs. So if you're crossing 35, you'll need more, and if you're crossing 40, you'll need more, like 40. At the age of 38 to 40, getting 40 mature eggs is very difficult, because around your AMH will be dropping after 35, and around 38 to 40 years, your AFC count, like in 1 month, I can see only maybe 4 or 5 eggs maximum to 6 eggs. So in that case, you might have to, the embryo, how many embryos you get will also come down. So how is the conversion? I say, if we are taking 10 mature eggs and doing ICSI to those 10 mature eggs, or IVF when we are doing to those 10 mature eggs, so conversion also depends upon the age and quality of the egg and sperm. So if you are less than 35 years, if we are doing for an ICSI for 10 eggs, the conversion, like day 3 or day 5 conversion, I will tell you. So day 3 conversion, like day 3 means you'll have less cells and more embryos, which means day 3 convert అవ్వడానికి embryos చాలా ఉంటాయి. 10 eggsకి నేను ICSI చేశాను అంటే around you'll have 7 to 8 day 3 embryos. So next, day 5. Day 5 conversion is around 60%. 60 or 70% అనుకోండి. సో నేను 10 eggsకి చేశాను అంటే డే 5 embryos రావడానికి 10కి you will get 5 or 6 embryos. సో ఇదేంటి, how madam, how day 3 and day 5 different? See, day 3 and day 5 both are embryos. డే 3 ఎంబ్రియో వేస్తున్నాము అంటే డే 3 టు డే 5 కన్వర్ట్ అయ్యి అది లోపలనే మన యూట్రస్ కి అతుక్కోవాలి ఎలా అయినా కూడా. సో వీ హ్యావ్ దోస్ కండిషన్స్. బై నేచర్ డే 3 ఎంబ్రియో క్యాన్ గెట్ అటాచ్డ్. బట్ వాట్ ఈస్ ద డిఫరెన్స్? డే 5 ఏంటంటే డే 5 వరకు ఎంబ్రియోస్ వచ్చాయి ఈవెన్ ఇన్ దోస్ ల్యాబ్ కండిషన్స్ అన్నప్పుడు ఇంప్లాంటేషన్ రేట్ ఈస్ మోర్. సో గెటింగ్ అ డే 5 embryo at the age of 40 will become less because the number of mature eggs we'll be getting is only less. So that is why considering your age, decide as early as possible if you have to go for freezing. So this is about egg freezing. And egg freezing, yes, socially and economically you have to go for egg freezing if you're thinking of delaying your pregnancy. But it is never 100%. If I say I have frozen 12 to 15 eggs of yours, the survival rate of those eggs when we thaw them will not be 100%. 100% of them will not convert into embryos, neither 100% of them will give you a pregnancy. Okay, so survival rate will be 80%. So if I am taking 16 eggs, the survival of those eggs when I thaw to do an ICSI will be around 12. Okay, always I would suggest, if you are married, if you have a partner, please get your embryos frozen before eggs. But egg freezing for now is important because the age of marriage, age of pregnancy is being delayed due to various reasons. So get your eggs frozen. If you are married, get your embryos frozen. Thank you.